My name is Jessica Aldridge, and today we're going to be talking about ADHD in women, how it's different, how it's dismissed, and how it's detrimental. We're going to be looking at an underdiagnosed population. Today we'll be discussing the types of ADHD, such as hyperactivity versus inattentive and combined. We'll also be discussing women with ADHD and what that looks like. And we'll be talking about how to get help with ADHD, whether you have ADHD or you know someone that does. So let's start with a working definition of ADHD. Attention deficit hyperactivity disorder is a chronic condition that affects millions of children and often continues into adulthood. ADHD includes a combination of persistent problems such as difficulty sustaining attention, hyperactivity, and impulsive behavior. Types of ADHD no longer include ADD. Actually, that was changed in 1987 in the Diagnostic and Statistical Manual in the 3rd edition. Hyperactive ADHD type is marked by the qualities such as run by a motor, so they never stop moving. They're usually active, fidgety, loud, impulsive, easily distracted, unable to concentrate, or they concentrate too much, such as hyperfocus. And they are more likely to present outwardly than they are to internalize their symptoms. Inattentive ADHD type includes markers such as forgetfulness, issues with focus, such as regulating and prolonged focus, trouble with organization, time management, and careless mistakes. Usually they're seen as daydreamy, flighty, or just plain careless about their situation. They are less likely to present outwardly, so they are more likely to internalize their symptoms, and it is more commonly found in girls. Combined ADHD type is when you take symptoms from both hyperactive and inattentive and mix them into one diagnosis. Gender differences include the different kinds of qualities that boys and girls present. For girls, it can be being withdrawn, anxiety, intellectual impairment, trouble focusing, verbal aggression such as teasing, taunting, and name-calling. That's just some of many. And for boys, it might be impulsivity, inability to sit still, lack of focus, including inattentiveness, talking excessively, or frequently interrupting other people's conversations and activities. As you can see, there's some crossover between boys and girls. Please ignore the cats. Gender differences also include other things such as boys being more likely to be diagnosed with ADHD than girls are. Girls can also present as hyperactive ADHD, but inattentive ADHD is more commonly found in girls than boys. A 2012 study found that college women with ADHD were shown to have higher rates of inattention, hyperactivity, and impairment than college women without ADHD and college men with ADHD. Analysis revealed that women in college who have ADHD experience higher levels of impairment in the following domains: home life, social life, education, money management, and daily life activities. So women with ADHD are more likely to be underdiagnosed because they don't present outwardly all the time. They are more likely to have inattentive ADHD than they are to have hyperactive ADHD. A 2014 study found that ADHD prevalence rates are higher among boys than girls. A low index of clinical suspicion exists for girls. Their presentation is considered sub-threshold because inattentiveness is more prominent than hyperactivity or impulsivity. Females with ADHD may develop better coping strategies than males to mask their symptoms, meaning they keep it inside, they internalize their symptoms. Lastly, anxiety and depression, common comorbidities in female patients with ADHD, can lead to missed or misdiagnosis. Childhood versus adulthood diagnosis means that a child has more time to get used to their ADHD diagnosis, whereas an adult may have to learn what they're dealing with before they even know what they're dealing with. The same 2014 study found that if not properly diagnosed and treated, girls with ADHD experience the same negative consequences as boys, including poor academic performance and behavioral problems. Unique issues related to hormonal effects on ADHD expression and treatment response are also experienced by women and girls. That means that girls and boys experience their hormones differently because of ADHD. A 2008 study found that recent evidence confirms that girls with ADHD are 5.4 times more likely to be diagnosed with major depression and 3 times more likely to be treated for depression before their ADHD diagnosis. That means that they're not getting treated for ADHD, they're being treated for something else because it doesn't look like everything else. So, comorbid issues. That means that women are dealing with PMS and ADHD, and a lot of women have reported PMS being worse because of progesterone, estrogen, and dopamine levels that they already deal with ADHD. So they're suffering a lot more during their PMS than they normally would if they didn't have ADHD. They also have to deal with comorbid issues such as anxiety, depression, and social anxiety that they may not have otherwise had if they did not have ADHD. Getting help with ADHD is for anybody, and I always suggest that therapy is good for anyone that wants to seek it out. But therapy for ADHD can help with mindfulness, meditation, emotional regulation, and provide a third-party objectivity. Medication is different for everyone, and everyone may not have the same kind of experience with medication as it is a controlled substance, and everyone has a different kind of reaction. Online resources. There are so many kinds of online resources of so many people that are willing to share their experience and how they cope with everything. So you can always check out online resources on how you might want to deal with some of these issues. And finally, coping and learning to cope is always really important because it's important for you to understand how you deal with specific issues having to deal with whether you have ADHD or any other kind of psychological problems. So today we learned about women with ADHD, how it's different from any kind of ADHD in boys, the different kinds of ADHD, how it's dismissed and because it looks so different than any other kind of diagnosis of ADHD, and how it can be detrimental to their health. But don't worry, therapy and other resources are always available so that people can help deal with their ADHD themselves.